Let's get started. So first and foremost, good evening. Thank you all for taking the time on what is probably a hot and muggy day for most of the country. But thank you for tuning in. My name is Jared Boyce, and I'm an MD PhD student at UW-Madison, and also a Cabello Health Fellow with Doctors for America. So tonight we're going to be discussing a very timely topic on immigrant children in detention centers and the effects that this has on them. We're going to hear from several experts on this important topic tonight. But before that, I just want to set some ground rules, expectations, etc. So first, as you may have heard as you joined the meeting, this is going to be recorded and all of the materials are going to be available afterwards. And then two quick ground rules for this session. So one, there's no such thing as a stupid question. Please ask your question. I believe we have a somewhere in the chat or Q&A. Please just pop your question in there. And we will work towards getting that answered after all of the talks. Two, for questions. Oh yeah, same thing that I mentioned. Remember that there's a Q&A feature. There we go. So we'll address those questions towards the end. In addition to that, look out for some comments. DFA staff might be sharing some helpful links during the session as well. Okay, so now that we've gotten all of that out of the way, I'm super excited to introduce our speakers tonight. So first, we will hear from Dr. Sean Sidhu. He's a child and adolescent psychiatrist at the University of California, San Diego, and has a plethora of experience in addressing the psychological trauma experienced by detained immigrant children. We will then hear from Dr. Alan Shapira, who is the co-founder and chief strategy officer of Terra Firma National. This is a nonprofit that provides medical, mental health, social, and legal services for newly arrived immigrant children and their families. He is not on the panel quite yet. He's probably finding a quiet place to join. He's currently at a conference, but he will be on shortly. And lastly, we will hear from Amina Hachful, who is the senior policy and litigation attorney at the Young Center for Immigrant Children Rights. They do a lot of amazing work advocating on behalf of immigrant children, including children who are currently being held in detention centers. So, with all of that being said, I'm going to turn it over to Dr. Sidhu first.
Hello, I will try to share my slides, and as is typical, I have way too much information for 15 minutes. So I might kind of skip through some stuff just in order to make sure everybody else has enough time. But let me go ahead and hop into sharing my screen. And I mean, I can introduce myself a little bit later. I think actually we already had an introduction. That was good. Thank you, Jared, for the introduction. We always acknowledge the people who lived on the land here locally. For us, it's the Kumeyaay Nation, and we have a lot of work to do to rebuild the trust with this group. You know, my personal style is feel free to ask questions as we go along, whether that's chat or anything else that you'd like. You know, just some kind of broad strokes. Many people, I don't want to put you in a box, but I would say myself included, have been feeling this way recently when you see what's going on in the world and you see what's going on around you, in this nation. You can kind of feel like, well, I'm trying to sort of be a source of light in the world, and yet like everywhere I look, it just feels like, oh, bad news and then bad news and then bad news. So if you feel that way, you're not alone. And why might we feel that way? Well, specifically with this topic, these are the things that have been said about an entire group of people. And unfortunately, these aren't things that were said from, fringe people. These are elected officials who are saying these kinds of things about an entire group of people. So regarding anybody who's potentially any immigrant, murderers, rapists, drug dealers, they're criminals, they're animals, this, and that. And I'm not going to go into all of it, but, these are things that are being said from our most trusted, leaders in the nation. And so when the question is, what is she thinking about all of this? And we're really seeing a dehumanization at a really large level, at a larger scale than we have previously. So when we dehumanize an entire group of people, it allows us to do what would otherwise be considered unethical and to justify it. And unfortunately, by creating a common quote unquote enemy, this is a way for people in power to gain and consolidate, sort of political power. So rhetoric matters, and why does it matter if this is what some of our streets are looking like these days? Numbers aside, we're going to talk about how a lot of these kids and families have been through trauma, and so when they see this type of a person walking down the street or approaching them, it's going to reactivate a lot of the traumas that they've already experienced, and so it can feel very, very bleak at times. But it's a reminder to us that in our darkest moments, the light does shine brightest. And if we all support each other, we can get to this kind of a feeling where, okay, there's a light, there's a light, there's a light, there's a light, and all of a sudden, it doesn't feel so bleak anymore. But sometimes easier said than done. Okay, so what happens? Why do youth and families flee? I'm going to try to give a really broad overview. There are 117 million people displaced. That's more than double the amount after World War II. And you think about all the places that were affected in World War II, it was a lot of the world. So, by the time this talk is done, it'd be like, 1,600 people. It's a lot of people that are being displaced. And why are people fleeing? I think there's a notion out there that's being pushed by some folks that people are just coming here to take advantage of American tax-paying dollars. But if you look at a lot of the literature on this, a lot of people are talking about fleeing because they're concerned about some form of violence or threat to their personal safety. And so what are the different types of traumas that people go through? There's pre-migration trauma that gets people to leave. There's migration trauma and there's post-migration trauma. We'll talk through some of that. A little bit of just a disclaimer for those of you who do have, experiences with trauma or who may be impacted, just that this could be hard information for us to discuss. So this graph, I think, really beautifully depicts that as armed conflict fatalities go up, which is red, you get more people seeking asylum and more people who are displaced and have refugee status. So this just beautifully describes that really asylum seeking is closely tied to conflict fatalities. And unfortunately, there are a lot of places in the world where there is a lot of armed conflict happening right now. But not just armed conflict, but even also people who are minorities for any reason. It could be race, religion, culture, gender, but also this is an example of LGBTQIA plus populations aren't always protected and sometimes can receive the life sentence depending or death penalty, I should say, depending on what part of the world that they live in. And so this is like pre-migration, just giving us a sense of why are people fleeing. It's effectively armed conflict, can be violence at the hand of gangs or government officials, or it could be because they're experiencing discrimination. And then, there's a certain percentage who may also be experiencing things like famine or other unlivable conditions. But often it's a pretty dire circumstance. Then once the question is then like, okay, migration trauma, like what is that? And migration trauma, first of all, crossing is very dangerous. But in terms of post-migration trauma, we had this government imposed family separation in the last administration, I should say 2 administrations ago, where we kind of split families apart. And most of these were really small kids who haven't actually been reunited. Some of them haven't been reunited with their families even this far after the policy was put into place. So what happens when we separate families? We shouldn't be too surprised by this, all of those of us in the fields that we're in. But, when you separate a kid and parents, the parents experience more PTSD, depression, and anxiety. And the kids experience attachment difficulties, developmental regression, emotional difficulties, behavioral difficulties. And the important part on the bottom here is that these impacts continue even after people are reunified. So that's the concerning part, is it doesn't just get better all of a sudden. And then in terms of detention, what happens when families are placed in detention, which was really, I think, the what this presentation was trying to get around. And if you want to read more on detention of families, I would recommend, you're welcome to check out this article. And this article doesn't do any original research, but what it does is there's a lot of references that you could look at also that could take you to other articles. But basically, what we were able to find in the literature is that any length of detention correlates to worse mental health outcomes, even if it's brief detention. And if you follow these people who were put in detention out 10 months, 3 years, and 4 years later, you see higher rates of PTSD, depression, and anxiety for those people who were put in detention, regardless of how long they were there, compared to people who were placed in the community while they awaited their hearings. This is just a graphical representation of rates of mental illness reported from kids and families in detention, and it's pretty off the charts. I mean, you look at almost all the parents are experiencing depression and anxiety, and a really high rate of suicidal thoughts as well, but even some psychosis. And then with the kids, as you look at the right part of the graph, you really see that developmental regression. So you start to see enuresis, onchopresis, food refusal, regression to napping, language regression, attachment problems. So these kids do really get impacted by detention. And then we can't forget these like really concerning reports that people have, at least made allegations of sexual assault in our detention facilities. This isn't some other country. This is right here on U.S. soil. Thousands of complaints, such that the Office of Inspector General, which is a United States office, launched this complaint. So the government was sort of complaining against itself. This wasn't some like fringe media group. So this is very concerning. Naturally, if someone's had a history of trauma and then experiences trauma in detention on our soil, that's only going to compound what they've already experienced. So as a result, it's not surprising that you see higher rates in migrant populations of mental health conditions. And so why should we get involved? I mean, our Hippocratic Oath is one sort of way of looking at it. Due process is another way of looking at it. When we take our Hippocratic Oath, as physicians, we say we're going to treat the person's, not just their illness, but also their family, their economic stability. And I have a duty to all my fellow human beings, not just ones on one side of a border or ones who have a certain type of insurance. So we kind of already agreed to this. So how can you get involved? And I think some of the other speakers are going to speak to this. So I'm not going to get too deep into the weeds here because I want to make sure everybody else has a chance to be able to share. But I mean, just doing clinical care and patient level advocacy is huge. And if that's all you can do, that's a big deal. And so these are unfortunately populations that have lots of barriers to care. There may be internal barriers, like if someone's depressed, they may not want to get help. There may be fear. What if I go and what if I somehow get in contact with an authority figure and then I'm at risk? It may be hard to navigate a complex system or language issues. So approaches to care, these are sort of just general tips that if you're working with a migrant family, really to think about the whole family instead of, oh, I'm just going to treat the kid because I'm a child psychiatrist, or just the parents because I'm an adult psychiatrist, or just one person because I'm a therapist or a social worker or psychologist. The whole family went through the trauma. Probably the trauma is multi-generational. And so if we help to do like everybody in the family approach at once, everybody can heal together at the same time, and then they can support each other even after they're no longer in treatment. So family center is probably the biggest thing. Trauma informed, definitely. I mean, people may be really afraid just to even come into our healthcare setting. So whatever we can do to help them feel safe and welcome is important. And then culturally sensitive, just understanding our Western medicine is not the answer for some people. That's okay. They may have their own traditional beliefs, and we may be able to learn a lot from how they, approach their own healing. So really, we want to empower people as opposed to, kind of talk at them and those sorts of things. So, for example, asking a family, what do you think is causing your symptoms? What do you think would be helpful, as opposed to our usual, well, you have this disorder and these are the things you have to do for it. So do they have any traditional healers, any prayer, any community gatherings, any rituals, anything spiritual, anything cultural? We want to support all of that. Okay, language. I'm not going to get too deep into this, but just for us to remember that we're less effective when we don't treat in the patient's native language. So whatever we can do, even if we don't speak the language, to get other people who do speak the language, culturally adapted interventions are 4 times more effective. So, and this really highlights the need that we need people from these communities to go into all of the fields that we're in, and to become providers themselves, so that they can help everybody. So what can we do at the health system level? I think we have to be careful with immigration information. We have to be careful how we document, because anything we document can be subpoenaed in court. And so if we're asking about immigration information, we need to be able to say, like, it's because we have specific resources in mind. So just so you know, like, we're not mandated to report any of this stuff. And all this is protected information in terms of immigration information under HIPAA. But we still have to remember, whatever we document can be subpoenaed. So we should only document what we're okay with being discoverable, if that makes sense. These are the Know Your Rights cards. They're helpful to review with people. Pulling a card like this out might actually backfire, because it might identify you as somebody who's, but I think who's, an immigrant or at-risk population. But knowing the content of what's on the card can be really helpful. Things like, I have Fourth Amendment rights. I don't get, you don't have a warrant to enter my home, things like that. So this is just to remind us that if we're going to care for migrant communities, it's important for our clinics to be in migrant communities, closer to, so it's easily accessible and it builds trust within the community. Your own sort of healthcare institution may have its own policies on what to do if ICE enters, but just the basic idea is you want to stay calm and professional, but you don't have to let anybody in without a warrant. You can contact your local security. Our job is to really treat and protect patients and know our rights, to document, to advocate. So we can get into more of the details later if people have questions, but I want to keep moving for time. And then this is just for us to remember, this isn't a time to put on our superhero cape and save people. This is a time to work along with people, create partnerships, and empower them to be in the driver's seat. So really patient-centered is the idea here. You can do asylum evaluations. This isn't an asylum evaluation training, so I'm not going to spend too much time on it, but I've done them and I've mentored people in them, and we can plug you in if that's something that is of interest to you. And they make a huge difference, as you can see here. If someone's requesting asylum, 10% chance just out of the gate, 30% if they have an attorney, but 90% if they have an attorney and a forensic assessment. So it can make a huge difference for these families. And these are some courses that you can take for asylum. I'm going to kind of just skip through some of this just in the interest of time. But Physicians for Human Rights, Mount Sinai, Human Rights Program, Humanitarian Outreach for Migrant Emotional Health, they make it possible to do remote evaluations and make it pretty easy. So these are just these organizations. And another way that you can help these families is to just volunteer, even if you are too busy or not interested in doing anything clinical. And Refugee Health Alliance is a place locally in town, and you meet on the San Diego side of the border, and then you go across and you can volunteer in the migrant shelters. And they do everything from medical care to mental health care to LGBT to midwifery. So really cool stuff. So this is just us, one of our groups when we went down there. It gives you a sense of what some of the migrant camps look like, and our makeshift pharmacy that we had. So we can kind of keep going. Different organizations. No More Deaths is really cool. They put water stations along places in the border that are really dangerous to cross, so people who are crossing can get electrolytes and first aid kits, and hopefully that it's not too dangerous for them then. And then last bit I'll talk about, I'm already at 15 minutes on advocacy, is just these are all different things that you can do. So I'm going to just get all the bullet points down, and then I'll go through each one of these. The bottom line, these families can't speak out because there's a direct and very real fear of retaliation. So they can't. They have no choice. Our role is to be able to try to sort of take their voices and share them with people who don't have as good of a sense of what they've been through. So you can get grants, and some of these are very easy to get, and very small amounts of money that you can use to do quite a bit with. and I'll talk about that in a second. But you can also write policy statements. Any group can write a policy statement. Like we could probably join up after this webinar and write a policy statement. But if you're involved with the ACAP, the APA, AAP, AMA, or any other local group, you can write these statements and you think, well, I'm just writing this statement. Who cares? But actually, when like the White House calls ACAP and says, what do you think about this? ACAP pulls out their policy statement. So it actually does make its way into these conversations. You can write an op-ed. Be careful. I never thought I'd have to say this, but if your immigration status isn't solidified, you do have the potential for retaliation. So unfortunately, I have to say that, but you have to kind of be careful what you write. If you stick with the science, you're usually okay. If you go into conjecture and rhetoric and very heated language, then you start getting into some difficult territory at times. You could talk to the news, the local news, and you could come do advocacy days. We talked about volunteering. So this goes back to the grant. Even if you got a grant for like $2,000, $1,500 paid for 70 mental health evaluations in Mexico for us. So what you might think needs $30,000, $40,000, $50,000, even if you get $1,000 through a grant, a small grant through your institution, it can go a really long way for these communities. So I think that that's pretty good. I think these are just pictures and things of advocacy and feel good moments, but I want to get off because I'm already 18 minutes here and make sure everyone else has a chance to present. Thank you guys. But any questions, throw them in the chat and I can keep answering.
Thank you so much, Dr. Sidhu. Dr. Shapiro has joined.
Hi, everybody. Sorry, I'm spreading around this evening. And so I'm just newly situated. So sorry, I missed the early part of the talk today. I caught the end of Dr. Sidhu's talk, which was fantastic and basically is almost like every single thing I've ever lectured about. So I think it was really very thorough and fantastic. I'm going to be a lot less formal this evening and just sort of tell you a little bit about my own journey in advocacy and the work that I've been doing since very intensely with newly arrived immigrant children since 2013. And that work, that clinical work that I did has taken me into a lot of detention facilities. It's taken me to the border. It's taken me to migrant camps. And so I'm going to talk a little bit about how my own experience helped me sort of find my advocacy feet. And so basically, my comments today are basically about what I've seen in the detention centers pretty much. And I'll say that my comments are based on the clinical work that I did with children released, unaccompanied children, and children and families seeking asylum that have been released into New York City. And just so everybody knows, I am based out of the Bronx. I work in a community health center called Bronx Health Collective, which is affiliated with Montefiore Medical Center in the Bronx. I have been in that health center since 1990. And really the work I did for many years was working with unhoused street youth and children living in the poorest congressional district in the United States, a lot in public housing, starting in 1990. The work I did, and I like to talk about primary care as almost like a sentinel, right? For finding what is new in the community. And that could be health conditions, but it could also be changes in population. And I'm sure a lot of you can relate to that from the work that you yourself do. And so I worked for 23 years on a mobile medical unit when unhoused street youth, and first in Times Square and then up in Harlem where the program moved to. And it was a young man that was brought on the mobile unit from Guatemala. He was from the Mom community, spoke very little Spanish, and actually had very severe mental illness and really couldn't tell us much about himself. But he had his card from his pro bono lawyer at Catholic Charities. And we called that lawyer to find out a little bit more about who this young man was. And we found out that he was an unaccompanied minor. And frankly, in 2013, I had never heard of that population. It was really new to me. And that's sort of what I mean about being on the street, literally, or being in a community where you can see the trends and what's new. And it was actually right before we saw a big, massive wave of unaccompanied children and asylum seeking families enter the United States in 2014. About 68,000 unaccompanied children, 68,000 members of family units in 2014. And maybe some of you remember then President Obama called it a humanitarian crisis at the border. Luckily, had already set up our medical legal partnership, which is called Terra Firma. And it was a program that brought integrated nonprofit legal services into our community health center. It was sort of tripartite. So it was legal, medical, and mental health. It grew a lot into a lot of social services, all the things that a regular community health center would do, but we built in a very big youth enrichment program. And it was really through this program that has served now close to 3,000 individuals that really brought me in touch with the journey, the trauma that many children have endured before they actually get into our health centers and communities around the country. That work then led me to being invited to work with human rights organizations to then become the eyes and ears, the witness, the medical witness of what the conditions were like in detention facilities. So I started first going to family detention centers, and I went to, at the time there was three. There was Berks in Pennsylvania, Carnes in Texas, and another one that subsequently closed in Texas. And I had gone to all of these detention centers with this group visiting sites, and really, like, it was really eye-opening. And a lot of the things that the children were and the parents were telling me, I saw firsthand, and I'm going to talk about that in a minute. That work also brought me to emergency intake sites. One was a tent city in Tornillo, Texas. Others were CBP processing centers along the border and OR shelters for unaccompanied children. So all of this work really informed me a lot, and informed actually the work that I ended up doing with colleagues. And I'm telling you all this because I know where there's an advocacy filter on this whole presentation today that got me and my colleagues who started seeing a lot of these children in their own communities to write the American Academy, the American Academy of Pediatrics 2017 policy on a policy statement on the detention of immigrant children. And that was the AAP's endorsement of this policy that then became a major advocacy tool for human rights organizations and even folks in Congress. And so became a really important tool. And I will say that we are revising that policy, but actually some of the same colleagues I work with and I are publishing a new policy in September, which is the reception of immigrant, is like re-envisioning the reception of migrant children and families. And I'll touch upon that a little bit at the end of my talk. So all of those trips really got me to see really opened my eyes to see what the children, the families were going through. I also think it's really important to point out that when we think about the health and well-being of children and families in the detention system, right, the first point of contact in the US, you have to remember that many of them traveled thousands of miles from their countries of origin, whether it was from Central America, South America, Africa, really anywhere in the world, who eventually come through Mexico and to the border. They've traveled countless miles. They've endured terrible, dangerous conditions. Many of them have been victimized through either things like sequestration, kidnapping, robbery, injury, etc., along their trip. And they've gone through all of this trauma, the trauma of leaving their country in the first place. And when you think of children, to leave their country, we say they are fleeing for their lives. And they are also, you have to remember, separating from their parents, oftentimes, from their friends, from their siblings, from their schools, from their whole culture. So that in itself is an incredibly traumatic experience. And they make this traumatic journey and they come to the US. And like, we are the first point of contact. And you want to envision, what should that place be like? What should it look like? What the food should be like? Who's taking care of the children? And frankly, everything that you would put down on a list. If we did an exercise right now, Jared, and we put down like all the things you would want in that reception center and compare it to all the things that actually exist, you would be shocked. And maybe because you're listening to this lecture and you heard Dr. Sidhu speak already, you maybe wouldn't be so shocked, but it was shocking to me. And, the first point of contact are these freezing cold warehouses, the processing centers, that are run by law enforcement, not child welfare experts. And that is very critical. And actually, when we did those site visits, those law enforcement agents were maybe as traumatized as some of the children, because they all of a sudden were thrust into this position of caring for children who have had incredible trauma. And so they were not trained properly for this. And I remember on a tour in Ursula in McAllen, Texas, the agent giving us the tour, and I was with the American Academy of Pediatric president at the time, broke down crying. I mean, he just, we really just exhibited so much trauma just talking about his job. You also have to remember that these are sites that have that first site, cold, bright halogen lights shining 24 hours, oftentimes no private toilets, no showers, terrible food, incredibly disorienting for the children. Many times children who are traveling with family members get separated from their families. They get put in separate cage facilities within this warehouse. The healthcare services are very cursory. They're basically looking for skin-borne infections, and they are not screening children in the way they need to. The other big problem is that they're very large. They oftentimes have over 1,000 people in them. And you have to think about a child who has just traveled thousands of miles is incredibly high risk for having deterioration. Sometimes they cross the river, they're drenched, and they get put in these freezing cold places without a change of clothes for sometimes 12 or 16 hours. And so they can deteriorate very quickly. And we have seen that happen. And we have seen children die in these facilities or die being transported late to other healthcare facilities. So this is very, very dangerous place for children. And the takeaway is that children and families should never be put in these type of facilities, these border processing facilities. Let me just switch a little bit to family detention. So family detention is where children who are with a parent or a legal guardian may get placed. So when families are apprehended at the border, they are then put in the same type of facilities that the processing facilities. But from there, they either can be removed. They may fail their credible fear hearing and they will get removed. And I've worked with a lot of families in Dilley, Texas, preparing them for their credible fear hearings. We could talk about that a little later. They can stay for long periods of time within that detention center. And in the Berks Family Detention Center that I worked in, we saw families that were there for over 1 year. We saw children who spent more than half of their life in detention. Or they could get released to communities. And unlike unaccompanied children, they are just let go and they have to make their way to communities across the country to reunite with family members. In the most recent case, in the last few years, when the border governors were sent, especially Texas, were sending families like across the country. Oftentimes they didn't have any connection with that city. New York received over 230,000 migrants in a couple of years. Many of them ended up in the New York City shelter system where we were. So we had a lot of contact with them. So when you think about in those family detention centers, the care, the medical care is slightly better. They do give immunizations, but frankly, that we found over and over again that the families didn't trust the healthcare facilities. There was very wide range of care. A lot of times, like we went to Carnes Family Detention Center. We were there in December. Not one migrant who had been there had gotten a flu vaccine. And this is, remember, a detention, a group facility, a congregate care facility. So it was very very spotty, the care. Oftentimes the professionals who are hired to give care at these facilities don't oftentimes trust the parents. And so the parents are telling them about their children's health. They're not being believed until the child is deathly ill. And we have seen cases like that of children that have been transferred out or have died in family detention centers. So those are some, then we talk about the emotional effects of children. And or the in child health, we think also a lot about the behavioral effects, right? So and you have to think about it. It looks differently for different age groups, for different developmental stage of the child. So in young children, what we witnessed was very regressive behavior. Children who had mastered bedwetting were now bedwetting. They became very clinging on their parents. They would not let the parents ever go. They would be literally holding onto their legs as they walked through the hallways, or they were very withdrawn, and were really not interacting with the other children. We're not socializing normally. Some of the children became very aggressive. And one of the things we saw is that the longer the children were in detention, the more aggressive we saw that behavior, including self-injurious behavior. I remember one child, I was interviewing his mom, and he was just chewing on his shirt and wrist until he was bleeding. Another child took the lariat that was holding his ID and started to choke himself. And another child came into the room with a rubber ball and was just smashing it against the wall. I mean, these were children that were so incredibly dysregulated. And I think Dr. Sidhu really explained well, like, that process and the effects of migration and detention on children. So remember, detention itself is re-traumatizing and actually is a major factor sometimes in their deteriorating mental health and behavior that we see. For the teenagers, we saw a real sense of desperation, but oftentimes like their parents. They showed significant anxiety, depression. We saw a lot of suicidal ideation, as was mentioned. And we also saw a lot of oppositional, defiant behavior. Children that tried to escape, even without their parents, from the facilities. We heard the children blame their parents for not getting them out of these facilities. So it really causes conflict within this family unit that should have been a family unit of safety and protection, but the teenagers often saw their parents then as becoming the enemy. And it was really distressing for us to see that kind of behavior. On the parent side, we saw incredible parental depression, helplessness, the sense of desperation about, not knowing when they'd be released. And also, like, the child-parent relationship was so broken that it really deeply affected their own sense of control, their loss of locus of control. They couldn't help the children with food, with cooking. So it took a very big toll on the parents. And we saw that over and over again. The parents were really in a state of high distress. And I think one of the things I heard in the last lecture, which I want to just say is very important, is that it didn't matter how long people were in detention, children or families were in detention. Any amount of detention was detrimental. Certainly, the longer children were in detention, the worse it was. And now we're seeing that in Office of Refugee Resettlement for unaccompanied children. So that's like sort of the last category, right? Unaccompanied children then get placed from those warehouses into the Office of Refugee Resettlement shelters. And those are many times they're like group facilities, group shelters. They could be foster care agencies. They follow state child regulations for child welfare, for residential facilities, so they have to follow the state guidelines. So there is better health care. They do get mental health screenings. They do get mental health care. But again, the being in detention itself is oftentimes a detrimental factor. So it's better. Most of the children that we have worked with say that it was such a relief to be in those facilities. However, the longer they were in those facilities, the worse their mental health became. And right now, I would say about 2024, maybe 2025 and before, the length of stay in these detention centers was about 30 days. It varied. It could go up to 60, it could be a little less, it could be 2 weeks. Right now it's over 200 days. And the reason for that is that the Department of Homeland Security has put such intense pressure on the sponsors. So the sponsors are the ones that are legally allowed for children to be released to. And those right now, they have to get fingerprinted, they have to get DNA tested, they have to show certain documentation and have to go to court to show that document. They are really at high risk for being detained in that process. And so it is a very, very dire situation right now for unaccompanied children, and we're seeing a lot less released into the community, which is very worrisome to us. And again, that also leaves them, I think, the vast majority of the children, I would say over 99% of the children that I have ever seen have never had comprehensive primary care. And so the need is very great just for it could be vision, it could be hearing, it could be screening for sickle cell, for tuberculosis. We've seen a wide spectrum of disease, but the main thing that children need coming out of the system is comprehensive primary care. And we worry that the children who are in detention facilities for a very long time are not getting the care that they really need. And the facility itself is making them worse. So let me just sort of end by saying that, just giving you a couple of the policy statement recommendations that we came up with. Some of it is very basic, but these are things that can be used and taken away. And this is just a few of the recommendations, sort of the global ones. We had a lot more specific ones for pediatricians or pediatric caregivers who are taking care of children once they're released from the facilities. So first of all, treat all children and families seeking safe haven in the United States with dignity and respect to protect their health and well-being. Eliminate exposure to conditions or settings that may re-traumatize children, such as those that currently exist in the detention itself right now. Separation from a parent or caregiver should never occur unless there's concerns about the safety of that child, and that should be reviewed by a child welfare panel. Children should not ever be subjected to CBP processing centers and should never be taken care of by law enforcement as their first point of contact. They should be kept in a child-friendly setting with child welfare experts. We should discontinue the use of family detention completely in favor of community-based release and management. And I think the last speaker also talked about that. All children should receive timely, comprehensive medical care that is consistent throughout the entire immigration process. That absolutely does not happen right now. Children should have access to trauma-informed mental health services throughout the whole system. That does not happen right now. And so, those are the things that we should really be thinking about when we are thinking about advocating for ending the system, ending the detention system as it exists right now. And I'm happy to answer tons of questions at the end, but I think I should probably end right now.
All right. Thank you so much, Dr. Shapiro. And last but not least, I'm going to hand it off to Abina to present.
Thank you so much, Jared. Thank you, Dr. Shapiro, for that wonderful, so comprehensive presentation. I could not agree more with everything you've said, and I'm so grateful for your work. And in research. So good evening, everyone. My name is Abena Hutchful. I use she, they pronouns. I'm senior policy attorney with the Young Center for Immigrant Children's Rights. And I'm based on the unceded lands of the Lenape people, known as New York. Everyone, you all understand better clinically the harm of detention to children and people's health than I wanted to talk about the two custodial tracks and the legal protections that govern each space for immigrant children, and what we can do, like plant some seeds to inspire action from this community. I will try to rush through it. It's so hard to talk about this in 15 minutes, but I will try to not repeat what others have said. I did want us to just ground in the acknowledgement that we've been doing this to people, to children, to families since at least World War II, as a matter of immigration policy, at least, family detention. And it's important to acknowledge that history to understand the structural framework in which this is happening. In the 1980s, a 15-year-old girl from El Salvador named Jenny Flores sued the government over her prolonged detention under horrible conditions. At the time, it was INS, Immigration Naturalization Service, that held immigrants, and everyone was together. And the result of this, over a decade of litigation, was the Flores Settlement Agreement. And that is a consent decree that the federal government signed that sets national standards for the detention, treatment, and release of immigrant children, including the basic rights to safe and sanitary conditions, access to, nutrition, food, water, clothing, emergency medical care, which the government has consistently violated. I say that to understand that Flores governs the federal government's treatment of children in all spaces, but also to preface that there are two tracks, as Dr. Shapiro talked about. There is also the Office of Refugee Resettlement, which is under the Department of Health and Human Services. That was created after 9/11. Which the Homeland Security Act split the care of children into these two tracks. So those who arrive with parents or who are over 18 are held under the Department of Homeland Security custody, and those who are under 18 or who arrive alone or are separated from their family are placed in ORR custody, the Office of Refugee Resettlement. And they're under the Office of Refugee Resettlement, there's another statute that governs the care of children in ORR custody, the Trafficking Victims Protection and Reauthorization Act, that imposes a requirement that children are placed in the least restrictive setting and are promptly released to their sponsors. And as Dr. Shapiro said, the delays are 6 times what they've been under prior administrations. We were working to get them below 30 days, and now we're looking at 6 months plus on average of kids in ORR custody. So that's not prompt release. The numbers of I also want to talk about, what the Flores Settlement Agreement sets in ICE custody, that children must be released without unnecessary delay, and the families must be released without unnecessary delay. And courts have interpreted that as setting like a 20-day limit, like what's a reasonable length of time. They have set 20 days. As Dr. Shapiro said, no amount of time is safe. And what the Trump administration has been doing is really weaponizing that 20-day limit to separate families and pressure them to self-deport. The closer you get to that 20 days, the more, you face the threat of being separated from your child who will be placed in ORR custody. So they give them this false choice of, deciding to either self-deport or be separated from their child. And that is, of course, deeply traumatic. Studies show that 60% of detained mothers are deported, as most lack counsel. And the Marshall Project reported in May that ICE has detained over 6,200 children. This, is within family detention and also youth, teens over 18. I think were included in that number. But the numbers are much greater. Brookings Institute reports that about 205,000 children have had a parent detained. And so we're talking about, family separation at a massive scale beyond under the first Trump administration. ICE's official figures have been, consistently much lower than what we're seeing reported. And we just can't trust that data. And so, I just say that that the scale of all this is greater than what we really are seeing reported. So there are sorry, just want to make sure I'm going. There have been a number of harmful policies since January 2025 that I want to try to go through, but it's really, this is just like the tip of the iceberg. First, and not even on this slide, is the heightened criminalization of immigrants and expansion of cooperative agreements with law enforcement agencies. One of the first legislation that Congress passed was the Lake and Riley Act, and that criminalized, that authorized the government to detain, basically expanded the terms for mandatory detention to include anyone who's even suspected of a theft crime or assault or against a law enforcement officer, or any assault leading to bodily harm, including evasion of arrest, right? And so what happens, people who are afraid of being detained and deported flee when they see ICE or flee when they see the police, and then they are charged with evasion or resisting arrest and held under mandatory detention. In March of this year, 19-year-old Royer Perez Jimenez was found dead in a detention facility, that Glades detention facility in Florida. He was a kid who was detained for a resisting arrest, right? And we've heard countless stories of youth being, caught in the trap because they were just afraid. There's also the reopening of these family detentions. It's really important to note that these family detentions that were opened, and expanded under the Obama administration, the Biden administration wound them down in 2021, but didn't actually end the contracts, didn't end family detention, right? As a matter of policy, they remained open. They just converted the contracts to hold women, or for overcrowded, for other uses, and then that laid the foundation for the Trump administration to reopen them and expand them, and use them for detaining families, children and families. Court filings, describe the overcrowding and the inadequate medical care and the contaminated food and water. And as of January of this year, so that's just after a year of this administration, DHS had held over 900 children beyond that 20-day limit. So they're actively violating Flores. Some of those kids had been held for 40 days, so double the limit. And this is also all that's coming out in litigation, that the government's being compelled to reveal this information. They've also moved twice to terminate the Flores settlement agreement outright. And they argue that Congress, congressional funding in the reconciliation bill justifies ending the court oversight, but it's because it's basically an endorsement of family separation, or at least, of family detention, and that there's no need for a court monitor and court oversight. The federal court rejected these arguments, and the government appealed, and that's still under appeal before the Ninth Circuit. There's a live fight for legal services. The government has attempted to terminate legal services for unaccompanied children. and also ended anti-trafficking programs that would protect children from detention and deportation, like deferred action for youth with special immigrant juvenile status, which is youth who have survived abuse, abandonment, neglect, many of whom are survivors of trafficking. We saw uptick in the number of youth with this protected status that really felt that they would be protected from detention and deportation, and were just waiting for the chance to be able to apply for their green cards. And DHS reported as of December, they had detained close to 300 of those youth and deported a third of them. And those numbers have certainly increased since then. Also, the government is working to gradually concentrate ORR facilities. This is for the unaccompanied kids under 18, to gradually concentrate them in states that have delicensed facilities that serve immigrant children. So Texas and Florida are two states that have delicensed those facilities, meaning that there's no state oversight. They don't have to be state licensed. And is working to get them further away from their attorneys and fast track their deportation proceedings and pressure children to take self-deportation. They're coercing children with promises of like a cash payout, which we've heard some reports actually goes to adults that children are deported back to, some of whom may not have their best interests. There was a one report of a child being left at the money order site after the adult picked up the cash, right? So we know that this is putting children actively in harm's way by coercing. This is the MO of traffickers, to coerce children to cross borders or enter or do anything that's like harmful to them with the promise of cash. Roughly 70% of detained children, unaccompanied children now, are proceeding through these fast-tracked deportation proceedings without an attorney. And we've seen reports that include just last month that the detention and deportation of unaccompanied children specifically has tripled under this administration. It's tripled under the second Trump administration as compared to the first Trump administration. And so these fights continue. One other thing, through the expansion of cooperative agreements with law enforcement, ICE is slowly taking over and perverting ORR's mandate by, conducting so-called wellness visits in children's homes, children who were in OR custody but then released to family or sponsor caregivers. They're conducting unannounced visits to those children's homes and leading to the detention of many of those sponsors, and in some cases the redetention of the youth themselves. And Dr. Shapiro talked about how the sponsor vetting policies heightened requirements that are immigration based and have less or nothing to do with the sponsor's ability to care for the child, has led to more family separation. Sponsors are going to verify their identity at these required mandated appointments, and ICE is there and detains them when they think that they're actually following the process, following all the requirements to reunify with their child who's detained. They're actually detained, and the child also remains detained longer. And so this is kind of blurry. I'm sorry. I put the source of this report here, the National Center for Youth Law's report on the unraveling of ORR, but you can see that uptick right there is basically when the Trump administration came into office. And the second chart shows the orange is actually discharges to other than a sponsor. So prior to the Trump administration, at least prior to these policies going into effect, the majority of kids who were released to a sponsor or caregiver. Now we're seeing that, first of all, releases have drastically declined, but also more children are being released because they're being deported or transferred to ICE detention. when they turn 18. So how you can help, sorry, Jared, I hope we're still okay on time. How you can help, there are many ways, but for this community, documenting and testifying through the medical legal partnerships like the wonderful Terra Firma that Dr. Shapiro heads, Physicians for Human Rights has been mentioned. The National Center for Youth Law is the lead counsel in the Flores litigation for unaccompanied children. And there is a designated monitor for those facilities. But they're also a good contact for conducting visits of ORR facilities, monitoring visits, and I think they also train people to do that. The statements and comments, there's ways that you can submit, comments to regulatory changes individually, but also by joining professional associations like the AAP and AMA that write in response to comments. There's an upcoming one, ORR is trying to codify these sponsor vetting requirements. And additionally, to authorize ORR staff to examine children's bodies for tattoos and gang markings. This incredibly invasive new policy was actually part of the legislation passed under the big ugly bill, the HR1. And this is in furtherance of the Alien Enemies Act, executive order, further criminalizing and targeting and re-victimizing immigrant youth, who many of whom are fleeing gang violence. And so there's a comment, notice and comment period that's open right now. You have until August 25th to submit your comments. If you just search NPRM, Notice of Proposed Rulemaking, and Sponsor Vetting or ORR, you should see it. And I can also send links through Jared and Raya. Supporting professional advocacy, we talked about, Dr. Sidhu talked about conscious practice and just being mindful also of the effects of the detention on your patients and their families. And then being part of narrative change work. We just launched this summer a narrative change campaign called All Children Belong, together with the Child Thrive Action Network and several of their partners in key states. And we are looking for opportunities to uplift voices, like credible messengers like yourselves, on just the harm of immigration detention and the deportation pipeline for children and families. And I highlighted this report as an example of just like the power of the medical community to create lasting change. The New York public interest lawyers, NILPI, they have a medical providers network that published 2 reports on abuses in Orange County Jail here in New York. And this year, we passed Dignity Not Detention Act that bans state and local contracts with ICE, detention contracts with ICE, and drastically will limit the ICE's ability to open detention facilities and detain people here. So that is a huge win. Really advocacy that was led and driven by the medical community, but also their ability to take, document, and uplift the testimony of impacted people who are detained. There's some recommendations here on what we want Congress to do that I will share again in these slides so that you can think about them if you're writing an op-ed or if you're writing a statement, and what are the policy asks that would be most helpful: restoring legal aid, preserving and strengthening the Flores Settlement Agreement, requiring pediatric specific standards of care. And I put some sources here that I would love these great reports for you all to read. And if you're interested in any of these calls to action, or if you're ready to like commit to one now, even in the comments, or like in the notes, you can drop what you're willing to commit to, or just reach out to me, and you'll have my contact, which I will send with the presentation to Jared. Thank you so much for your time. I hope I didn't go too far over the allotted time.
Great. Thank you so much. Dr. Sidi has been answering the 3 questions that were put in the chat, which is amazing. Thank you so much. I just want to open it up for another couple of minutes, and we can just focus on these 3 questions. Sorry, I will do kind of rapid bullet point. But first question, how can people outside of medicine get involved in tangible ways, especially when you are still a student and not yet in industry or academia, for example, public health?
I think I had tossed into the chat some thoughts, but I'm happy to hear what my colleagues have to say too.
Can I offer 2 things? So there's the All Children Belong campaign, which you talked about. That's more of a narrative change. Anybody can be part of it, but your expertise is important to highlight. And then also we are able to do our work of our core work or core program is a child advocate program, which appoints child advocates to particularly vulnerable unaccompanied children who are detained. And we work with volunteers to do that, who visit the children and help us, understand more of what they're experiencing, and advocate for them, through their direct voice. And that we're able to do that in all of the facilities, the ORR facilities. So just like looking up the Young Center and the Child Advocate Program and ways to volunteer.
Yeah, I think the only thing I would add to that is, almost every community now in the country has a immigrant rights or a community immigration advocacy organization, really to protect the community. And that could be everything from a whistleblowing campaign to bringing children to school, to shopping for families, et cetera. So, and being a witness. So I think that's just something in your community that you could do if you're not working in a professional capacity. The other thing is that there are programs. There's something in New York City called the Sacred Court Support. So it's going to court with people, because we know, like in New York City, the court houses have been a place where there has been a lot of abuses by ICE. And so really being a witness for families or for people going into court. So there are organizations like that you can work with.
Second question, to summarize, as a medical student, interested in child and adolescent psychiatry, yay. And also interested in working in policy, what do you recommend to get involved? Dr. C, do you love to comment? I also love to comment, just to say for everyone else, join Doctors for America. Shameless plug. I'm the co-lead for the Decrim and Liberation subcommittee. So please feel free to reach out. I dropped my email in the Q&A section on the answer. I also work on resolutions for AMA, AAP, so on and so forth. Email me. But I'll leave it open for our panelists. For this last question, to summarize, basically very comprehensive and well-rounded series of presentations. But what do you all believe is the impact to our society and America / the US as a whole, to our morals, ethics, sense of who we are as a people?
I feel like I can state kind of the obvious that, there are all these kind of quotations we have from inspirational figures in the past about, a society is measured by how it treats its children or by how it treats its most vulnerable populations. Ultimately, unfortunately, I think it's hard for the narrative to cut through the mass media about what these families are experiencing, because neither political party seems to want to take this on right now because it's seen as politically unpopular. Previously, there was sort of like a split where there was sort of one I think camp that was a little bit more interested in projecting this narrative, and it felt like in the last election it was sort of like let's see if we can prove who's tougher on immigration seemed to be the debate on the stage, as opposed to what are these families going through. So, but we can bury our head in the sand all we want. Ultimately, this is going to have a huge impact on our society and on humans across the globe. And the more that people like you are able to do the work that you're doing, the more that we're able to kind of like, it might not be a huge thing or it's millions and millions of people at once, but even for every single individual family you help, that person, their life is really changed in a very drastic and dramatic way. And that helps us to keep from getting kind of like burnout and kind of feeling hopeless and dejected ourselves as providers. So I think it's enough from me, but definitely, yeah, I mean, it does have a big impact on our kind of moral and ethical framework as humans.
My hope is that it also awakens awareness on our just like collective, our shared humanity and like interconnected struggles. Like I think this what we're experiencing here with mass detention and deportation is really like the lighter version of what's happening in Gaza, right? Or what's happening across all Palestine. Like it's that we're all connected, and I hope it like awakens in us this sense that like, oh, if this group, this community can be impacted, or if the government can easily take away, so the rights of so many, and you know, are really like taking, they're looting our country to fund this, then who's safe? Like who that we need to fight for each other in order to protect ourselves, if we really believe that we are deserve dignity, that we are humans worthy of compassion and dignified treatment, then everyone is. And I also think that like the sense of like moral rupture. I just came back right before this from a protest, and I met someone who was saying, I used to not even like protest. I used to think that these don't make a difference, and then I came to one, and then I came to another, and I'm not saying that like protest is the only answer. I'm just saying that there are ways in which we can use travesty. We can use the or like it be let it spark action in us, and creativity in terms of how we show up in the fight. So that's very general. I know that's been said many
I
times.
think what Abina just said is really powerful, and I think if we think about like the first child parent separation family separation 1.0, the entire country came out against that, and it ended within weeks. And frankly, I am a little horrified that we are not seeing that level of protest. We are seeing the No Kings marches, etc. But I mean, people, there needs to be outrage. And I frankly think we also have to talk about, I think the way to depoliticize it, as much as it's possible to depoliticize this issue, is to talk about the humanism in medicine that we see, the effects that we see in medicine, but in just the humanity of what or the inhumanity of what we're seeing. And I think that that is something that cuts across, all political divides. I'd like to think so. I mean, I don't want to sound too Pollyanna either, but I do think when you see some of the things that we have been seeing in this country, people are outraged. And I think I'd like to see the schools, the universities actually shutting down because of this issue. And I am waiting for that to happen, and I don't know what it will take. So that is.
And if I could just add one to that point to that, that's why I thought it was important for us to recognize that these family detention facilities were open under Obama and Biden, right? That like it was inhumane then, it's inhumane now. We need to focus on the shared, humanity. Couldn't have said it better. Thank you.
I mean, just speaking from a medical student perspective, one, I think I think schools will quite literally shut down. There is one school, I will keep it anonymous for now just in case, but there's one school, you can find it on a quick Google search. In New York, there's your hint. That is facing a major enrollment crisis, and that is partially due to this because international students don't want to come. And I just met with a PI today, and they had said that they had um, lost a postdoc opportunity because that student that was graduating decided to go back to their home country because they did not want to risk potentially being thrown into a immigration detention facility for doing absolutely nothing aside from being a scientist who was born in another country. I grew up near New York, with the Statue of Liberty always being present and knowing the history of why the French gave us the Statue of Liberty, comparing that to what we see today, it is the complete opposite. It is antithetical to our very nature and to the founding of this country and what this country was founded for. It was built on the backs of immigrants. Many of the major innovations that have been made in this country in contributions to medicine, science, law, service industries, etc., is because of immigrants and people who were born in a different country who either came here or who were forced to come here fleeing persecution and violence. And it's tragic that we have fallen far, far, far away from that. I think institutions need to step up. I will also throw in medical institutions into that crowd as well, that have largely chosen to remain silent, including when they have explicit policy that commands them to act on certain issues or legislation that is introduced to Congress or at the state level. People have just chosen to turn a blind eye. So I will leave it at that. I hope that you all have learned a lot from this session and are also a little bit more motivated to do whatever you can to address these major issues that are affecting not just children but families at large and people from all walks of life.